Hi, Dr. David Stoker, board certified plastic surgeon here in Los Angeles, with a great looking 36-year-old mother of two who we performed breast augmentation on approximately 9 months ago. She was a 34A cup and she wanted a conservative, natural looking appearance. She wanted to increase approximately 1 cup size to a full 34B. We decided to go with Sientra textured round high profile 255cc implants, and we achieved just the look that she was striving for. We have little nipple covers on here so for privacy, but you cannot see the incision there very well at all. It's super discreet along the inferior border of the areola. There are no marks anywhere on the breast. She's doing a great job protecting her skin from the sun, I would say, for a Caucasian woman in Southern California. She's doing really well. Just to mention to all the viewers out there, it's really important to protect this area with sunscreen, especially after I do breast surgery. It's extremely common for women to go out with that area exposed, and inevitably they get a lot of sun exposure, sun damage, and it's difficult to reverse in that area. So don't forget to protect that asset once you invest in your body like this. We did this operation through the areolar incision. We put the implants in a submuscular dual plane pocket. What does that mean? There's a pectoralis major muscle coming across the top here. The muscle covers the top 2/3 of the implant, but it does not cover this area out here because there is no pectoralis major muscle. If you go with the saline implant, sometimes you can see that the implant underneath, and in extreme cases or cases where there is diminished elasticity of skin, you can sometimes see rippling. The implants that we went with here are the latest and greatest gummy bear implants. They feel extremely natural. There's no, even though I know there's an implant in there, I really can't feel it. And if I can't feel it, I don't think anybody else is going to be able to. That's fantastic on a person who's already pretty lean. The leaner you are, the more possibility of being able to feel that implant. And so going with a gummy bear style cohesive gel implant can give you a lot more natural feel and appearance in this situation. Another thing that we used in this case is the Keller Funnel. That's a slick tool that we use during surgery that allows us to slide the implant through a tiny little incision with minimal disruption to the implant. It's unlikely that we're going to cause any damage to it at all. It's less stressful on the tissues here, so you get a cleaner healing incision, and the incision can be smaller than we would otherwise normally need to make to get the incision in there, the implant into the pocket. The last thing is it's a no-touch technique, so in putting that implant in, it's not necessary for me to use my hands, so it can go straight from the sterile packaging into the funnel, slide it into the pocket, and it's one more thing that we do in the combination of techniques to arrive at a rapid recovery breast augmentation technique. And what that means is basically doing a bunch of these different steps very well and selectively so that we minimize the bruising and trauma to the patient, they have the fastest recovery possible, get back to their business, in this case, her 2 children. So she's a nurse actually, and that's another thing that's really fun for me in my practice. I have a lot of healthcare providers, whether they're physicians, physician assistants, nurses, coming to me as part of my practice, and it always makes me feel good that my fellow healthcare providers are choosing me for the surgery, but it also makes it even, I guess, the stakes always go up too when it's somebody in the industry. So I'm very pleased with the result here. I know she is too, and I thank her for sharing the result with us. So it's Dr. David Stoker, board certified plastic surgeon, breast augmentation on a 36-year-old mom. We went from 34A to 34B with 255cc high profile Sientra textured round cohesive gel implant.